Right. So to look at the trigger points of gluteus maximus, let's first review it. Origin first originates on the coccyx, that tailbone way down there. The edge of the sacrum, the entire edge, the whole way, which is palpable. Posterior iliac crest, this aspect of it right here. And then the sacrotuberous and sacroiliac ligaments, which we can't see in this view, right, because they're covered by the glutes, but we looked at when we sculpted them. Questions on those ones?
Those are the three that ran off to the IT band.
Yes, let's get a picture.
When we were.
So the sacrotuberous is that big one that's shaped kind of like a Y all the way from the PSIS. Sacrum, yeah, down to the iliac. Yes, exactly. And then, yeah. And then our other one we were looking at, well, let's just do that. Iliotibial tract up top where proximally where it kind of flattens out more all around the greater trochanter, and then the gluteal tuberosity. So review on the gluteal tuberosity. What you do is you palpate the greater trochanter, and then you feel a couple inches distally to it, right? And it's a roughened area that you can feel. So you can find that on your models, the small models. It will not be as obvious as a big model. I recommend at some point you go up to the big models as well. But you first find your greater trochanter, and then you feel a couple inches distal to it, and it's a roughened area on your models. They have it roughened as well, and that is palpable. Questions on that one? Tender, yeah. Great place to massage, right? Big, big, strong muscle. So with our actions, again, let's say them and do them. So if you can, stand up. And if you can't, you can also use your model and do the movements on your model. So let's say them and do them. We're going to extend the hip. Extend the hip. Good job. Ladder. Yes.
Super extend or
they can do extend and hyperextend. Great question. Yep. And laterally rotate the hip, turning your leg out, like say it and do it. Laterally rotate the hip. Awesome. And abduct or abduct the hip. Abduct the hip. Yep. And then the lower fibers can also adduct the hip. And say it and do it. Beautiful. All right. And you can sit down if you like. Now, one thing that's confusing or can be confusing about the hip muscles, and we're not going to go into great detail about it today, just food for thought. You can start working it out in your mind if you want. We were doing the simple version of the movement where the foot is off the ground. That's called an open kinetic chain. A closed kinetic chain would be when your feet are on the ground. The muscle can still have the actions, but it changes what happens. That can be a little bit of a mind twist. So I'm just putting it out there. We're not going to piece it all together yet.
Because that would be the same as a client laying on the table and bringing their part of their body off the table.
It would be like the open chain, right? Because they can move their foot. Yeah. Yeah. So basically, if your feet are stabilized, when the action is happening, right, the action has to happen more on the pelvis because the foot isn't free to move. So, all right, so that's our gluteus maximus review. Let's take a look at the trigger points.
how can you extend the hip from the feature? Just trying to picturize how, because you know, in the open chain, we have to move knee to leg. Right?
Yeah,
In
yeah,
order for that action to happen in the hip.
yeah.
But if our feet are ground, then how can we?
So if the same muscle is tightening, it's just going to pull on the pelvis.
Or you're trying to figure out how to actually do the movement.
Yeah,
Which,
it won't do the movement, or
It changes the movement. If the feet are on the ground and you're still tightening the same muscle, it can move the pelvis if it's a anterior or posterior rotation. And if it's a lateral or medial rotation, you can twist the whole pelvis that way. If the feet are stuck, but you're still doing that rotation.
but you couldn't do extension.
If you're extending and you can't extend, that sounds like a cone. If you're extending and you can't extend. Then you're pushing off so your leg is able to still move. Yeah, it's more like a pelvic rotation at that point. Yeah, play around with it some. We'll come back to it.
You would be able to be in anatomical position, but actually be in a certain pose to do that.
so then
In the lunge position.
is it in the extending of the hip would the glutes?
The gluteus maximus muscle. The gluteus maximus is the large muscle group that forms the buttocks. This muscle is twice as heavy as the gluteus minimus and the gluteus medius combined. It functions to prevent hip flexion after the heel strike phase of walking and is very active in bending at the waist and squatting motions.
So this gets to both like what Gio and James were saying. Once your foot is down, you don't want to keep leaning forward in your gait. And so if you see people continuing to lean forward too much, that and the flexors are part of what's overactive.
Here are the landmarks. We have the sacrum, the ilium, the femur, and the sacrotuberous ligament. The origin of the gluteus maximus is on the posterior bordum of the ilium, the sacrum, and the sacrotuberous ligament. And the insertion is on the gluteal tuberosity of the femur and also on the iliotibial band of the fascia lata via the aponeurotic sheet.
I like that.
I like that too. So we didn't learn tensor fascia lata yet. There's a muscle with that name. Yeah, I want one, a double, please. 12 ounce. So I don't know. I'm making you guys think a lot on a Monday morning, but with the gluteus maximus inserting into the IT band, what does this make you think about, like clinically? And I'm gonna pause. So here is tensor fascia lata. It inserts on the anterior third of the iliac crest and then down into the iliotibial band. And it's another one that a lot of massage therapists neglect. And I think, I speculate it's because it's so far forward. People don't think about it, but it's a really good one to massage.
Contraction of the gluteus maximus produces extension of the hip and lateral rotation of the hip. The hamstrings and posterior fibers of the gluteus medius are synergistic during extension, and the piriformis is synergistic during lateral rotation. The iliopsoas and rectus femoris oppose this muscle during extension, and the adductor magnus opposes the gluteus maximus during lateral rotation.
Clinical findings for gluteus maximus trigger
The
points.
clinical findings for gluteus maximus trigger points. Dr. Travell refers to the gluteus maximus as the swimmer's nemesis muscle. Clients with trigger points here may complain of pain and tenderness in the gluteal region, especially while sitting, aching pain while walking uphill and or in a bent forward position, and, as its nickname implies, cramping during swimming. Some activating factors for gluteus maximus trigger points include swimming, a fall or near fall, impact trauma, prolonged uphill walking while leaning forward, an intramuscular injection as with a flu shot or booster shot, sitting on a thick wallet, and true SI joint dysfunction.
So they can get their trigger points treated.
The gluteus medius, the gluteus minimus, and the hamstring trigger points are all functionally associated with gluteus maximus trigger points. Clients with active gluteus maximus trigger points are commonly misdiagnosed with sciatica, SI joint dysfunction, and trochanteric bursitis.
I don't know. Because the video is playing. He paid extra for that knowledge.
Is there something about thick wallet, or is it because of the weight of the wallet?
That's a great question. I mean, I have always thought of it more as like the sitting on it.
Sitting on that.
Yeah.
It's the same thing, if the pocket, is weighted down.
Yeah, totally, totally. Yeah.
Like long ischemic compression wallets.
Yes.
I have several clients who work for companies who've been driving in jobs a lot. And both of them, just the accumulation of years have these great big wallets, and they shun me we want them to.
Yeah.
When I was young, I have my wallet in my and my son joined was out of the
Yeah, people will often say at least to switch pockets. And if you don't switch to not putting your wallets in your pocket.
What's my wallet? Oh,
Yeah. Yeah. Because the phones are pretty big too.
And that eventually cause strain.
how heavy do you think people's wallets are?
And it was like, this thing around. First. Well, that's like us carrying our purses and what.
Yeah.
So it's also,
Yeah.